Hi, good afternoon. My name is Joshua Keith, and I'm here to talk to you about health literacy and how to impose using layman's terms to better help our patients understand their medical treatments and their procedures. Commonly known today, health literacy can cause several different complications with patients. One of the things that can cause complications could be the medical jargon terms that we use that often confuse patients. Medical jargon is also known as a common language amongst the healthcare professionals. So using terms as obliquity, lateral, anatomical positions such as to your left or to your right, as opposed to the provider, can cause complications with that. So what exactly is health literacy? According to the U.S. Department of Health and Human Services, health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate decisions about their health care and their treatment. Often in the medical field, we see these confused patients due to our medical terms. For example, I have my partner here, Amy. I'm going to demonstrate how exactly confusion can come in contact with during a medical procedure as an X-ray technician. Hi, Amy. Joshua.
Hi, how are you?
Good. So today we are here to do a hand X-ray of your right hand. So if you could just place your hand right here on my hand, and if you could, we're going to start off first with a oblique hand, which is rotated at a 45-degree angle laterally to your right. Can you do that for me?
I'm sorry, what?
So case in point, thank you, Amy. Case in point, speaking like that to a patient can cause that confusion. So that's when we implement layman's terms. And what layman's term is described and defined as is a universal language that anyone can understand. So rather than stating to the patient, if you can please rotate your hand at a laterally oblique position, you would then use layman's terms to break it down to that patient so that they understand and that you also understand yourself. So here is another example as for layman's terms rather than medical jargon terms. All right, Amy, so we're going to try this again. So we're going to do another x-ray of your right hand. So if you please place your right hand right here. If you could, can you please turn your hand to the right at an angle? Very good. Now, did you understand exactly what it is I had asked you to do compared to the previous time that I asked?
Yes.
Okay, very good. Now, instead of saying, can you please turn your hand to the dorsal aspect of your side, layman's terms would suggest, can you please rotate your hand to the back side of your hand on top of my hand? Thank you. So those are some of the examples and ways that you can use layman's terms to better help the patient understand. Using these layman's terms can solve several different problems. It can solve the problem of confusion. It can set a trust between the patient and the provider for themselves. Also, it's a common language known between the patient and the provider as well. Now, not only does this clear up the language barrier, but it also helps reduce the amount of X-ray exposures. So if I were to tell Amy, using medical terms and in jargon terms, obliquity, lateral, to your left, anything like that, she may be confused and she may be scared to not speak up to say that she does understand. I would go behind the x-ray booth and expose her to unnecessary x-ray and not get the diagnostic x-ray quality that the doctor deserves to treat the patient, which causes an exposure that the patient did not need. So using layman's terms to clearly make the patient understand the positioning wise would always ensue that you get the perfect shot with the only one shot that an x-ray tech needs to take for that patient. So covering our last three lines here, for my proposal, of course, would be that I propose that we use layman's terms to effectively communicate to patients to help them better understand medical procedures. With this plan in effect, we can achieve better provider and patient relationships that ensure less hostility, setting a trust with patients, and ultimately reducing non-repeat exposures, all while saving time, protecting our patients, increasing patient volume in our clinics, and ultimately helping our patients understand complex health information. So thank you very much for my presentation.